Okay, so moving on to presentation and symptoms. As we discussed before, there's a state of chronic anxiety. The patient is unable to stop worrying. They have difficulty on obsessing over the problem or problems that they have. This would be known as catastrophizing, which is making the problem a lot bigger than it actually is. It's very common in teens, especially in adolescence. This leads to a constant restlessness and irritability, which, as we discussed before, impacts social performance and academic performance. So the inability to resolve these stressors is the main reason for anxiety.
Here we talk a little bit about the etiology. There's much about it, so you split into 3 parts. First of which, we'll start with the heredity percentage. It's actually very high, with a 30 to 40% chance of passing it on to the next generation. A little bit going into the physiological reasons for such a disorder. We start with the amygdala abnormalities, and specifically the right amygdala, which is in control of inducing negative emotions. And when someone has a hyperactivity of the amygdala, it could set it off in non-threatening situations, causing them to overreact and stress when there is no reason to. We also look at the autonomic nervous system as being another reason for someone's stressors of being released, because of their fight or flight response activating, because the body will release adrenaline when the person perceives a threatening situation, and this will cause many bodily sensations, as well as the feeling that they want to run away. And the problem for people with GAD is they feel this in seemingly normal situations, so they have trouble controlling this bodily function. And what's also bad about it is they have trouble returning to a normal autonomic level as well. There are also problems with neurotransmitter dysfunctions, including GABA, which is an inhibitory transmitter, which can shut off other neurotransmitters, and if this isn't functioning correctly, it can not suppress sometimes the anxiety that's being taken place. Also, norepinephrine is another one that can affect it, as well as dopamine and serotonin, which plays a huge role because it deals with the well-being of a person, and when this is not performing correctly, then the person may have motivational issues or perhaps don't see themselves as they should. Part 2, this has to do with more of the child, starting with temperaments. Some temperaments that seem to be present with anxiety are inhibition, so you unique mix of wariness, arousal, and also you'll see a lot of negative affectivity with them, which is, of course, the negative emotions that may take place when they reach a stressful situation. And you find that these people have trouble regulating their emotions, so when they reach a stressful moment or that triggers it, maybe a threatening situation, maybe not, they don't know how to control emotion. They maybe begin to hyperventilate or freak out, stress. And also, you'll see this anxiety with cognitive and attentional biases. Say a person perceives usually a lot of things as being, threatening. They'll be more inclined to have anxiety episodes or continual anxiety more than others. And also kids who have anxiety sensitivity to maybe their own bodily functions, so they'll freak out when they have a normal stomach ache, or they'll feel uncomfortable in their own skin, which gives them this continually floating anxiety of just feeling stressed all the time. Part 3, we're going to talk about more of the environmental factors, the first being learning theories. Kids will learn what will trigger their anxiety, and sometimes it can harm them, because if you have a parent who maybe has anxiety as well, they'll perceive things being threatening and they'll pass it on to you because you'll see how they react. It can also play a major role in conditioning. And also parenting styles plays a major role as well, such as overprotective and over-controlling parents seem to be the most consistent with kids with anxiety, because maybe they make them afraid of the outside world or seemingly harmless stimuli. And the fathers specifically in the parenting role play a huge part. Maybe they show a lack of affection, making the person uncomfortable, or they're overly controlling. Maybe they didn't discuss with the child proper risk-taking, so they don't feel inclined to go out in public, and they just feel an overwhelming anxiety from most social environments. As well as some fathers will most likely be in charge of nurturing independence for that person and teaching them that they need to be able to live on their own. And if they don't convey this message, then the person will have trouble interacting in a normal environment.
Okay, so moving on to the treatment approach, we have, there's a clear avoidance for medication in childhood. This would be your selective serotonin reuptake inhibitors and your selective norepinephrine reuptake inhibitors. Therapists like to push for cognitive restructuring, and this is activities that make the individual not stay so concerned about the problems that provide them with stress. There are a handful of coping techniques that also help with that, and there are social workers that strictly work on this with individuals in order to help them better themselves. So they aim towards moving towards living in the moment, existential living. They keep from obsessing over the stressors as well. So continuity in adulthood, it's highly likely that anxiety will follow them into adulthood with their problems. This is where, if it is unresolved, therapists will provide mood stabilizers, which we talked about before. Unless there's comorbidity with substance abuse, this can lead to chronic use and dependency, which is not what a therapist or social worker is looking to lead an individual into. It's hard for individuals to get off of the antidepressants and SNRIs.